Judge, welcome back to the program. We last spoke with you at the first of the year, and you said that Travis County is badly in need of a mental health diversion center to keep nonviolent people with mental health problems out of the county jail. There has recently been some movement on that.
Yeah, I was really happy that we had a vote here in Commissioner's Court. Me and Commissioner Trevelyan brought the resolution to court to start that process of building a mental health diversion center here in Travis County. It passed unanimously, and now staff is working to bring back some details to kind of get it through the process of hiring a design firm eventually, and then eventually getting someone to build it. But the problem persists. Our jail still has a huge number of people who have unmet mental health needs, a huge number of people who are waiting, frankly, for the state hospital system to accept them for competency restoration. And so this mental health diversion center, once it's up and running, would help with all of that and help reduce recidivism of people who really need mental health help rather than, spending a couple of nights in jail. If we can get them that help, get them stabilized, that's going to help our safety and help people's healthcare here in Austin.
Judge, this process is really just beginning, but how soon do you expect this up and running? And then more importantly, how would this get paid for?
Yeah, so it's a process. So the staff is going to come back to us in a few months with a proposal to send out to a design firm. Then because of, contracting rules, because it's a public entity, we have to put that out for a bid. That comes back. Once we get the design back, then we have to have another bid process to actually build it. So, 2 years away, probably at minimum, to have that thing up and running. We're trying to do things in the interim to help increase mental health services, but that facility that's really going to meet our needs will be 2 years away. As far as paying for it, we have a couple options. One, of course, the county could pay directly out of our ongoing revenue to run it, and then we would have to build it either going through the bond process or through a CO. We're also talking to Central Health, our healthcare entity, about whether they could actually operate it and pay for either all or part of it. But really, it comes down to the fact that the state is not meeting its burden. And we right now have something like 150 people in our jail who are just waiting for a state mental health bed. And that's costing us millions of dollars each year because the state is not meeting its duty and its burden of taking those people and helping them restore to competency so that they can have trial. This is one of those unfunded mandates that the state doesn't like to talk about when they say they have this big surplus. In my opinion, they really don't have a surplus because they're just forcing costs down on counties. All 254 counties across the state are dealing with the same issue.
Judge, once this gets up and running, what kind of a real impact do you expect it's going to have on the county jail there in Travis County?
Yeah, so we have looked at a lot of different models around the country. I went to Tucson last week, previously went to Nashville. We've looked at Harris County, even Williamson County, our neighbor just to the north. And one good concrete example is Nashville. They have a facility that is a little different than we would want, but has a lot of the tools that we would want. So they have 30 beds for men, 30 for women. People go in there, they first get arrested and booked, and then if they complete the 14-day average stay in the mental health facility, then their charges are expunged. And they have noticed a 70% reduction in recidivism for people who go through that mental health diversion center in Nashville. And their jail population, unlike ours, has been going down since this center was opened 2 years ago. We have gone from about 1,400 people in our jail at COVID to about 2,200 people today. And a lot of that, over 40% by our measure, in reality, it's probably more like 70%, is people who have unmet mental health needs. So I think that if we follow something like the Nashville model or Miami or Tucson or some combination thereof, we will see a significant reduction in recidivism. We'll see a significant reduction in people in our jail who have mental health issues. And I think we'll see a safer Travis County.
Well, it's interesting considering the impact that other places have seen. The state Senate right now has just passed a bill that would ban face masks requirements by school districts, cities, counties, even the state, but it only applies to COVID-19. COVID-19 is behind us now. What do you think this bill passage is all about?
Man, it's just all about politics, and it certainly is not about science. You know, if we look back to those days of COVID when it was surging here in Travis County and across the United States, there was a time when we worked really well with the state on a lot of those protocols. We worked hand in hand with the state on getting folks vaccinated. Obviously, I think I was sued twice by Governor Abbott over masking, things like that here in Travis County. But in the end, when you look at the measures that we took here in Travis County, some of which involved masking orders, working with local businesses, working with school districts to have masks in those places, along with our high vaccination rate, we had a death rate in Travis County that was much lower than the state average. And in fact, my understanding is if the state had had the same death rate from COVID that we had here in Travis County, there would be another 40,000 people alive today in the state of Texas. And so when the legislature focuses on, you know, these non-scientific responses to very scientific pandemics, when they focus on, you know, drag shows and things that frankly have nothing to do with the real issues that are confronting our counties and our cities here today in Texas, it makes me sad, because I think there's a huge opportunity when we can work together. One of my favorite things about being county judge so far is that I worked with a Republican judge in Bastrop County, Caldwell County, and the state of Texas with TDEM to vaccinate people at Circuit of the Americas. It was a wonderful nonpartisan effort. And I think when we focus on how do we do that, more of that, that's how we win as Texans and make safer societies.
Finally, Judge, I want to ask you about fentanyl. Earlier this year, you said it was going to be a growing problem. It was a growing problem in 2022 and now in 2023 as well. Several bills are under consideration in the legislature. It would legalize or decriminalize, rather, the fentanyl test strips. It would allow for mapping of overdose cases and even charging drug dealers with murder if anyone died from an overdose. If these were to pass, what kind of an impact do you expect that would have in Travis County?
Yeah, first on the positive side, I'm really glad that Governor Abbott agreed with me and others in the need to legalize fentanyl strips in our state. That will save lives. It has done so in New Mexico and I think 17 other states so far. In talking with our medical examiner about one of those bills that basically would take away the power of a medical examiner to make medical decisions and instead force them to say, anytime you find fentanyl in someone's dead body, you have to say that it was because of a poisoning. That's taking away a medical decision. That's something that medical examiners do not do. They do not make assumptions like that of anything other than what they see and what they are analyzing. And so that, again, that bill is political and frankly doesn't help anything. I am encouraged that the governor and the state of Texas are interested in supplying more Narcan statewide. I think that has shown that it saves lives. But I think we need to focus again on the saving lives part. We need people with lived experience who can counsel others on how to stop using opioids and not use fentanyl. We need to work with all public health sectors to reduce the number of overdose deaths. I have every indication from our medical examiner that last year will be worse than the previous year in terms of overdose deaths here in Travis County, as I believe is happening statewide and nationwide. It's terrible, but I think that we need to take a public health approach to it to save lives of people as young as high school students and frankly from every socioeconomic background who are dying of these overdose deaths. Again, I think we need to look to science and how to save lives and how to prevent these deaths and how to get out of this opioid epidemic.
Judge, it's good to talk to you again. Thank you for the time.
Yeah, thank you very much for your time.